I'm Jean-Pierre Limbardet. I'm a psychosexual and relationship therapist and a clinical supervisor. I've worked 18 years in the NHS and private practice as a therapist and a supervisor. I'm a member of the COSRAT, which is the College of Sexual and Relationship Therapists, as well as a UKCP member, UKCP, the UK Council for Therapists. My theoretical orientation is integrative. I think it's important to mention it because it's an approach with which is holistic and pays attention to the client's personality and their emotional needs, psychological needs, biological needs, social needs, interpersonal needs, which are integrated into a psychological way of thinking. I work with individuals and couples. I work with male and female individuals and couples presenting with a wide range of psychosexual difficulties. Perhaps it's important to define what psychosexual therapy is, which is a branch of counseling and psychotherapy, which is specialized in sexuality and in sexual difficulties and in managing also sexual difficulties within relationships. It's a very important part of psychotherapy because sexual difficulties can be very distressing and can be very highly sensitive. And often people with sexual difficulties don't necessarily know where to go with a problem. The problem I can help with are particularly problem with, which are sexual dysfunction per se, which are problem with desire, sexual desire in men and women, or sex drive. It's very important perhaps also to actually define the difference between sex drive and sexual desire for people to know, which is that sex drive is an individual's sexual motivation, sexual interest, which varies from people to people. And while the sexual desire refers to attraction to a particular person, like a partner, for instance. The other problems that I can help with are problem with arousal. So the most common arousal problem is in men in terms of erectile dysfunction, erectile difficulties, but also in women. Women also have arousal difficulties, which I can help with. And also finally, problem with the orgasm. So the orgasmic problem commonly are the premature ejaculation in men, or the opposite problem, which is the delayed ejaculation, and the female anorgasmia, whether primary or secondary anorgasmia in women. Also, I see a lot of people with a lot of women with the coital pain syndrome, which is painful intercourse, and known as dyspareunia or vaginismus. So these are the sexual dysfunction per se. There are other problems I can help with as well, which are problems with the sexual orientation or sexual identity. Typically, gay men, gay women, bisexual women struggling with their sexual orientation. And also sometimes people with transgender issues struggling with their sexual identity. Other problems which are non-sexual dysfunction I can help with as well are people who need to come to terms with a history of child sex abuse or sexual assault or rape. People with sex addiction or internet addiction, which is a growing problem, particularly with the wide use of the internet. and I think that's the non-sexual dysfunction that I can help with. In recent years, I've worked and specialized in the field of sexual addiction, sex addiction. And I've also co-facilitated a group of gay men with sexual addiction in the NHS, and it was a pioneering group in terms that it was the first group run in the NHS for sex addiction, and it's something that we hope to actually carry on. So sex addiction is what has interested me the most recently, particularly because there's been a lot of new way of thinking about it and new developments about how to help people. What I enjoy the most about my work is to be able to work with flexibility, flexible hours in the comfort of my home, and also to see very interesting clients with very sensitive human problems, presenting with a large variety of human difficulties.